Hello, my name is Ryan Eland and welcome to your adult CPR training course. The following video will demonstrate proper CPR technique for adults. The following techniques should only be used on people older than 8 years old. We want you to walk away from this course confident and knowledgeable. If anything is unclear, please pause and rewind the video and watch it again until you fully understand all of the techniques. So what exactly is CPR and why should you know it?
The lack of oxygen-rich blood flowing throughout the body can cause organs to fail and can cause brain damage within minutes. CPR can help keep oxygenated blood flowing and vital organs working until more advanced medical help can arrive.
More often than not, an unconscious victim will not regain consciousness while receiving CPR. When you perform CPR, you are manually doing what the heart and the lungs can no longer do on their own. This is why it is so important to not give up or get discouraged if the victim does not regain consciousness. Let's get started on the training. The first step is to check the victim for responsiveness.
Tap the shoulders and speak loudly. Be firm and loud, but do not shake or hurt the person. Remember, you are trying to wake the victim up. If the victim doesn't respond, yell for help. Finally, check to see if the victim is breathing. Let's look at this step again. Firmly tap the shoulders and shout to try to wake the victim. Yell for help. Check for breathing.
If you are with somebody else and the victim does not regain consciousness, immediately have the other person call 911. If you are alone, immediately begin chest compressions. Chest compressions are an extremely important part of giving proper CPR. To give high-quality chest compressions, you need to remember these three things.
First, location. Draw an imaginary line between the nipples. The location is just below this line, in the middle of the chest. Second, depth. Push at least 2 inches deep. It is crucial that your compressions go deep enough. Third, rate. The rate of compressions is 2 per second. Make sure to not speed up while performing compressions. Going too fast will greatly reduce effectiveness. Carefully put the victim on his or her back on a hard surface. Place your palms in the middle of the chest, just below the imaginary line between the nipples. Location is important. Make sure that you are not too high or too low. Please take note of the demonstration for the exact location and the proper hand position. Now, push straight down at least 2 inches. Make sure that the chest rises all the way back up before you push down again. Do 30 compressions at a rate of 2 compressions per second while counting out loud.
Chest compressions serve to manually pump the heart. Remember to count out loud as you do the compressions so you don't lose track. Also, make sure that the weight of your body is vertically positioned over the victim when you're performing chest compressions. This will allow you to perform compressions for a longer period of time and will minimize physical exertion. Let's watch this one more time.
Carefully place the victim on his or her back on a hard surface. Find the middle of the chest just below the line between the nipples. Push down at least 2 inches, making sure the chest rises all the way up before pushing down again. Perform 30 compressions at a rate of 2 per second.
After you have completed 30 high-quality chest compressions, you will give 2 rescue breaths. Rescue breaths serve to fill the lungs with oxygen so that your chest compressions send oxygenated blood to the rest of the body, primarily to the brain.
Put one hand on the forehead and ease the head back while lifting the chin with the fingers of your other hand. Pinch the victim's nose and cover the mouth with your mouth, creating a seal. Give a firm but gentle breath for 1 second, watching to make sure that the chest rises. It is important to not breathe too hard. Let the air escape, the chest will go back down, then give one more breath. It is very important that you actually see the chest rise with every breath. If the chest doesn't rise, then the air is not getting into the lungs. In this case, readjust the head and give another breath. Let's look at this again. Gently tilt the head back to open the airway. Pinch the victim's nose and cover the mouth with your mouth, creating a seal. Blow 2 breaths for 1 second each. If the chest doesn't rise, reposition the head and try again.
If you are by yourself, you will need to continue giving 30 compressions and 2 breaths for about 2 minutes. This is equivalent to 5 sets of 30 compressions and 2 breaths.
After the 5 sets, you should call 911. Then continue giving CPR until help arrives or the victim wakes up. As always, if another person comes along while you are giving CPR, have this person immediately call 911.
All right, now let's review the entire process.
Check for responsiveness by tapping and shouting. If the victim remains unresponsive and you are not alone, have the other person call 911, then immediately begin chest compressions. If you are alone, begin CPR. Carefully put the victim on a hard surface. Place your palms just below the line between the nipples and press down at least 2 inches. Give 30 compressions at a rate of 2 per second, making sure that the chest rises back up after each compression. Pinch the nose and place your mouth around the mouth of the victim, creating a seal. Give 2 gentle breaths for 1 second each, letting the chest fall after each breath. Repeat the cycle of 30 compressions and 2 breaths 5 times. If you are alone, go call 911. After calling 911, continue giving CPR until help arrives or the victim regains consciousness.
The main things to remember with adult CPR are the following. Number 1, remain calm and assertive. Number 2, getting advanced medical help on the scene is always a priority. Number 3, give high-quality chest compressions by pushing at least 2 inches deep at a rate of 2 per second, making sure that the chest comes all the way back up after each compression. And number 4, give high-quality rescue breaths by creating a seal and watching to make sure that the chest rises and then falls after each breath. Thank you for watching your adult CPR training videos. It is crucial that you study the written curriculum along with watching these videos. We recommend that you go back through the videos and review everything until you know all of these techniques by heart. Thanks again for choosing our website for your CPR training.